Hello, my name is Alice Carrington. I am an RN on a telemetry floor, and today I am going to teach you the basics of how to analyze a rhythm strip. We commonly call them telemetry strips. I will refer to them both ways in this PowerPoint presentation. The floor I work on, I generally do 3 to 5 strips a day every 8 hours. So it's a very important skill to master if you're planning on working in the hospital on a floor that monitors hearts. The objectives for this PowerPoint presentation, when it is done, you will be able to categorize telemetry strips. You will be able to identify some abnormal rhythms, and you will be able to identify irregularities on a telemetry strip. You might necessarily not know what irregularity you're looking at, but you will definitely be able to pick out an irregularity. All right, so there are parts of a strip that you need to look at when you are analyzing it. The first important part is the graph. It's in red, it's boxes on this slide. On the horizontal axis, this is how you're going to tell your time, which is very important when you're analyzing a strip. So basically, if you look at the graph, the width of each small box is equal to 0.04 seconds. Now, if you take 5 small boxes and put them together, they make up one large box that is equal to 0.20 seconds. So if you have 5 large boxes, that's equal to 1 second. 15 large boxes, that's equal to 3 seconds. And 30 large boxes is equal to 6 seconds. And 30 large boxes is your whole strip. There are other common parts. If you look at the other part of this slide, it starts at the P wave. If you look below where it's labeled P wave, you're going to look at the PR interval. Next to the PR interval is your QRS complex. After that is your ST segment. It goes from the S to the T wave. And then there's your U wave. And if you look at the top, there's your RR interval. The most common way and the easiest way is to break it down into steps when you're doing a rhythm analysis. So the first step is to look at the regularity, and you are going to determine if the rhythm is regular by looking from your R to R. You're also going to look at your rate, which you're also going to use the R to count the number of R's on your 6-second strip. You're going to look at the P wave for any irregularities. Next, you're going to measure the PR interval. Step 5, you're going to look at the QRS complex. And step 6, you're going to look at the AV relationship. So to do your rhythm analysis, the first thing you're going to need is a set of calipers or an index card to measure. I find an index card is just as effective. So if you look at the center of this slide, you're going to find time markings. They're little red slashes above the actual strip. There are 3 on this strip. So if you look from one time marking to the next, that's 3 seconds. If you look at all of the time markings, it's a 6-second strip, and that's what you're going to be analyzing in the hospital. Again, I want to go back over the time because that is the most important part. For every time you do a strip, you're going to have to use the time. So the width of each small box is 0.04 seconds. The width of each large box, which is your 5 small boxes, is 0.2 seconds. 5 large boxes is equal to 1 second, 15 large boxes is equal to 3 seconds, and 30 large boxes is equal to 6 seconds. All right, so the first thing we're going to do is we're going to look at the strip for regularity. So you're going to take your index card and you're going to mark the first 2 R's, which are the high peaks of the QRS complex, on your index card. Then you're going to take the index card and you're going to go from R to R all the way across the whole strip. Now what you're looking for is you want them to be regular. So if they don't vary by more than 3 boxes, then you have a regular rhythm. Now if it varies more than 3 small boxes, your rhythm is irregular. On this particular strip, it is a regular rhythm. The next thing you're going to do is you're going to calculate your rate. The quick method to do this is you're going to count the number of complexes in your 6-second strip. In this particular strip, the number of R's that you have is 8. You're going to take that and multiply by 10, and your rate is 80. That is the quick method. Now, if you want to do a precision calculation, and you want to have your rate exactly right, you're going to count the small boxes between 2 R's. So on this particular strip, there are 18 boxes. So if we look on the next slide, this is the electrocardiographic conversion table for heart rate. We're going to go down the column for the number of small spaces to 18. And we're going to go across, and that's going to give us our rate of 84. So this rhythm, looking back at it, is regular, and the rate is 84. All right. The next thing we're going to do is we're going to look at the P wave. Okay, so on this strip, 1 P wave should precede each QRS complex. It should be smooth and rounded. All the P waves should look identical. They should have a normal amplitude, which is less than 2.5 millimeters of height. And they should have a normal duration, which is less than 0.10 second in length. So we have 3 beautiful P waves here. Next thing we're going to do is we're going to measure the PR interval, commonly referred to as the PRI. So what you do is you measure from the beginning of the P wave to the beginning of the QRS complex. In this example, it is 4 small boxes. Now we need to do the math. So the math for this one is 0.04 seconds times 4, which is your 4 small boxes, and it's equal to 0.16 seconds. So a normal PR interval is 0.12 to 0.20 seconds. So this one is 0.16 seconds. It's a normal PR interval. If your PR is greater than 0.20 seconds, it is called first degree AV block. A shortened PR interval is associated with junctional rhythms or other types of heart block, which we will look at in the next PowerPoint presentation. The next thing we're going to do is look at our QRS complex. So to measure, you want to measure where the QRS leaves the baseline to where the ST segment begins, which is also referred to as the J point. Now, I haven't spoken to you about baseline, but if you take your index card and you line it up on the flat parts horizontally on the strip, that is your baseline. So, again, where the QRS leaves the baseline to where the ST segment begins, in this example, it is 2.5 small boxes. I know what you're saying. How can you say 2.5? Well, if it falls directly in the middle, it's a 0.5. Here it is 2.5 small boxes. We have to do the math. 0.05 seconds times 2.5 equals 0.10 seconds. So a normal QRS is 0.04 to 0.10 seconds. So this is a normal QRS complex. If you had a widened QRS complex, which is greater than 0.10 seconds, it is called DIVC, which is delayed intraventricular conduction. Oftentimes, this is caused by a bundle branch block. Nurses cannot diagnose a bundle branch block, so we need to call this a widened QRS complex or DIVC. If the patient is diagnosed with a bundle branch block, in the chart, you can label your strip a bundle branch block. And lastly, what we need to look at is the AV relationship. Now, does atrial depolarization cause ventricular depolarization? I know, huge words. So simply, does the P wave cause each QRS complex? Does it precede each QRS complex? So on the top, very nicely, you can see P wave QRS, P wave QRS. It causes it. It has a AV relationship. So on the top strip, yes, it does. Now, if you look at the bottom strip, is the atrial depolarization causing the ventricular depolarization? Is the P wave preceding each QRS complex? So if you look at the first P wave and then the second P wave, you can see that they are not, that is not the way a strip should look. So on the top strip, yes. On the bottom strip, no. These are my references I used to create this PowerPoint. I used my resources at Upstate Medical University, and then I used an EKG book, the only book you will ever need. And lastly, I wanted to thank you for your time in viewing my PowerPoint. If you have any questions, they can be asked to me by email at acarrington@cuca.edu. I'm more than happy to answer any questions you might have about this, and thank you again.